Non-regenerative anemias in dogs and cats. Non-regenerative anemias are anemia with low reticulocytes due to insufficient marrow response. It typically takes 4 days for marrow to respond to anemia. The causes of non-regenerative anemia can be drugs such as chemotherapy, estrogens and antiparasitics, or pathogens such as parvovirus, FIV and leishmania. The causes of primary bone marrow suppression are pure red cell aplasia, aplastic anemia, and bone marrow fibrosis. Deficiency in iron or vitamin B12 can also be a cause, as well as chronic kidney disease, Addison's, and hypothyroidism, and neoplasia such as leukemias. The clinical signs are weakness, pale mucosa, lethargy, and exercise intolerance, and an increased heart rate and increased respiratory rate. In the diagnostics, in the lab, we can see low reticulocytes and hypochromic microcytic red blood cells in iron deficiency. The tests that can be done is checking the serum iron levels and doing a bone marrow biopsy and checking for any underlying diseases. In iron deficiency, we can see a low level of serum iron as well as low iron binding capacity, as well as hyperchromic microcytic red blood cells. In the case of pure red cell aplasia, the cause is immune destruction of erythroid precursors, and the treatment is immunosuppressants such as prednisolone. In the case of iron deficiency anemia, the cause is chronic blood loss or poor diet, and the treatment is iron supplements and to manage the cause of the problem. And in the case of anemia of chronic disease, the cause can be chronic inflammation, infection, or chronic kidney disease, and the treatment is to address the underlying disease. In the case of vitamin B12 deficiency, the cause is gastrointestinal disease or a hereditary receptor defect, and the treatment is vitamin B12 supplementation. And in the case of bone marrow disorders, the examples of this are aplasia, fibrosis, and necrosis. And for the diagnostics, you do a bone marrow biopsy. In neoplastic anemias, we have acute lymphoblastic anemia and chronic lymphoblastic anemia. The signs of acute lymphoblastic anemia are hepatosplenomegaly, fever, and weight loss. And the treatment for chronic lymphoblastic anemia is prednisolone.